Let's imagine better health with CHI Health. Sports activities, a bad fall, or just maybe some wear and tear all can lead to a rotator cuff tear.
If you're looking for cutting edge, there's a new procedure that's minimally invasive and only one doctor in the metro is performing it, and he's here with us.
Bingo, right here from CHI Health, orthopedic surgeon Samuel Dubrow. Good to see you, Doctor.
Nice to meet
Hi.
you.
Stopping by. So we're talking about rotator cuffs. I'm trying to figure the rotator cuff. It's a tendon. It's a tendon that rolls down your shoulder.
It sure is. It's a group of 4 muscles that form this confluence, and a tendon is a muscle's attachment to bone. So it combines of 4 muscles that make a cuff, or this confluence of them that surround the ball and socket. And it's easy to tell by looking at this model here. This pink or peach region right here is the rotator cuff. It surrounds the ball, and it allows the ball to move in a functional manner within your shoulder.
So when you tear it, in essence, what are you doing, and what are the long-term implications of it?
So the main thing the rotator cuff does, other than provide us with rotation to our arm, is it stabilizes the ball within the socket, keeps it in place. When you get a tear, over the long run, the ball destabilizes or comes out of the socket and can cause pain, functional pain, when you're trying to move your arm. This is commonly seen in larger tears. Not every tear that's going to happen with. If you have a small tear, it's not going to destabilize that ball and socket. Large tears, the ball is going to come out of the socket, and if you can see in this model here, this is the ball, and this is the socket right here. And if there's no rotator cuff, it's going to come out and pinch the bone above it. So we keep it in the socket.
And that's
like
when you
that.
start getting some pain. Some
Right,
serious
exactly.
Pain, right?
So the procedure that I do, and many people have friends who've had rotator cuff repairs, and some patients or some people do very well, others do not. And the reason why they do not is because they likely have an irreparable rotator cuff tear, meaning the rotator cuff didn't heal to the bone where it's supposed to when they had it fixed.
So for years and years, patients really had few options, but I mean, you had what you had. And now we have this new technique where you're training surgeons all over the place on it. What's different about it that benefits the patient?
Well, when the big thing is, if the rotator cuff cannot be repaired, it's irreparable, meaning that tendon quality or the muscle quality of the tissue is similar or akin to a wet piece of tissue paper. And you can imagine how weak that is and how easily that tears. And if you put sutures through that, it's going to tear right through, and you can't fix it. And these patients who have had previous rotator cuff repairs or have large tears and they can't be fixed, they continue to have pain and decreased function. We can't replace the rotator cuff. We haven't been able, and you can't repair that. So we reconstruct it, which means we put a patch in there to take the place of the rotator cuff to keep it stable in the ball and socket so that you can move it in a functional manner.
That makes sense.
And are you seeing more of these type of surgeries? I guess, how is it impacted? Because you have a population out there, that, an older population, an aging population, yet they're still active. I imagine that the type of these surgeries you're seeing.
Mike, you got it. I mean, there's a lot. Everyone is active these days. Your 50s and 60s, they want to play baseball, they play softball, tennis, and they keep using we're living longer. We want to have a functional and athletic lifestyle, so we're putting a lot more wear and tear on our arms, and we're seeing more and more rotator cuff tears, especially people that have had them fixed 10 years ago or even longer ago, and we didn't even have the best ways or means of fixing them at that point. And those patients continue to get recurrent tears, or it never healed, and they go on to having really bad problems in their shoulders.
So with this reconstruction, even if you've had a problem in the past and it was fixed to the best of science at that time, you could still have this done down the road if you re-injure that rotator cuff.
100%, and that's the #1 patient I see it on. It's usually patients that have had rotator cuff tears previously that failed or didn't work, or it did work for maybe 5 years, and then they continued to play sports and aggravated it, and there's no tissue left. That tissue is irreparable. We can't repair it, so we have to reconstruct it with a patch.
Could you do this with young athletes too? I know we're focusing on folks who are older and might injure their shoulders, but if you're a high school athlete or something and you hurt yourself, could you still have this new technique done?
Usually it's not necessary in that age group. They're kids or people really under the age of 40 have healthy tissue, and you commonly don't see an irreparable rotator cuff tear at that age. It's when they're 40 or above you see it more commonplace.
Can we talk a little bit more specifically about recovery time with this type of procedure? Not only recovery time, but any potential complications and how that's different from the older procedures.
Right. Well, the nice thing about this is it's not burning any bridges. Meaning, if you have this surgery and for some reason it fails, and I'll be honest with you, I haven't seen one fail yet, but if it does, you still have the option of having surgery down the line, because this is done arthroscopically. It's minimally invasive. We're not losing any bone. We're not, we can still do a shoulder replacement down the line if that's needed. And that's the #1 reason why we do shoulder replacements now for patients that had a failed rotator cuff that never healed. So if we don't have to have a shoulder replacement. If we can do this instead, that's great. And then if this works and works for 10 years and you need a shoulder replacement 10 years from now, that's great as well.
So are you able to then, after this procedure, start to move your arm and within a couple of weeks?
Yeah, most patients, well, all patients, I keep in a sling for 4 weeks. That's it. After 4 weeks, they no longer require a sling anymore. And I have about half the patients go to physical therapy, half of them don't even require physical therapy at all.
Wow.
It's amazing how specialized care is getting these days, because at CHI you have the shoulder center, right? And that's kind of like a one-stop shop for all these type of issues. Explain a little bit more in depth about that.
Sure. Well, we have, there's myself and 2 other physicians that specialize in shoulder surgery. We all did special training, fellowship training in shoulder surgery, and are the shoulder surgeons there. We work with physical therapists and physical medicine and rehabilitation physicians to coordinate care for our patients, so it's kind of a one-stop shop. They come in, they get their ultrasound of their shoulder or an MRI, we give them a diagnosis right away and talk to them about surgery or non-surgical treatments for them.
It's much more convenient for patients, and I feel like the process from the beginning to the end, it's a better result because it's choreographed for them instead of trying to figure it all out yourself. You've got the professional sort of guiding you through it. That way you're able to get back to life, right? You're feeling great again. Online at chihealth.com, and then we showed you a couple of addresses just a moment ago where you'll find this gentleman, the only guy in the area doing what he does. It's nice to have you here, Dr. Dubrow.
Thank you, Mary. Thanks,
We
Doctor.
appreciate your
Thanks a lot. Thanks
time.
for coming.
Next.